Hey everyone, welcome back to New Method. I'm so excited that you're here. And today is a special podcast because we have a guest. This is part of our newer season where we have guests on our show because there are so many amazing people that I've met along the way and I wanted to share access to them. So today we're going to have Sandy Kruse. Sandy Kruse is the host and creator of Sandy K Nutrition, Health and Lifestyle Queen podcast. Now with over 1.3 million downloads. She's also a biohacker and an aging well advocate at 54 years old. Sandy educates on alternative means for healing, wellness, and preventative care and shares them with the world through her podcast and social media presence. She just released the Essential Thyroid Guide and is working on her book, Blending Science and Soul to Optimize Wellness. So without further ado, I'm going to bring on Sandy. So I'm so happy to have you here, Sandy. Welcome to our podcast. I'm really excited to have you here because I was on your podcast a long time ago and so happy to have my audience now hear everything you have to say because you're just amazing.
Thank you. Thank you so much. I'm happy to be here.
Of course. So I always like to start and kind of to hear your origin story, like how this is the world of crazy people. We are in the vortex of crazy. What made you decide to come to the dark side?
You know, it's that, what do they call it? A hero's journey? Is that what they call it? You know, when you have the experience and then it's like an epiphany and you go, oh my God, like I'm meant to do what I'm doing. It actually started way back after the birth of my second child. I started to have a lot of issues that were completely unaddressed. Women often are ignored after childbirth. And that was 100% my situation where, you know, you go and the baby has the visits and it's the baby's visit. Meanwhile, I had a husband who traveled. He started traveling when she was 2 weeks old. And so I had a newborn and a toddler and I was exhausted. She had all sorts of issues. I didn't sleep for 8 months and I became so thin and I didn't have enough breast milk. I'm like, something's wrong because with my first child, I had plenty of breast milk. I didn't have these issues, but it was never really assessed. And then fast forward many years after that, my daughter, so this would have been, I had her when I was 35. She was diagnosed with a cancer at the age of 5. So I was 40. It was
kind of cancer?
Soft tissue sarcoma. And I found it one night. I was doing tickles before bed and it was right under her arm in the fatty part of her arm. I'm like, again, mother's intuition. I knew. I'm like, this is not a normal fatty cyst. So I went through a year of not sleeping, not eating right. I broke my foot. What was it? 2 days before diagnosis. And I wasn't able to, see, I was a bad patient. I never went to the fracture clinic, never did anything, just would take the boot off to drive her to appointments. And it was literally a nightmare time. And the stress was so huge that whatever maybe began 5 years prior just exploded. And then I was diagnosed with thyroid cancer almost exactly 1 year after she was diagnosed. And then we actually had our surgeries exactly, her second surgery, my first, 1 year apart. So October 2010 and October 2011. I still remember it very well. So I was told I would take one pill. They would take my thyroid out, a couple of lymph nodes. It was thyroid cancer. Let's just take the whole thing out. Fine. You'll take a pill. You'll be fine. This is well before I became a health practitioner and I wasn't fine. And my kids, right? My kids were watching me. Oh my God. I still remember. And they're like, you know, I had no vitality left, no energy. I had infections that wouldn't heal. And I'm like, I got to fix this because I'm not the person I want to be. I had no energy. And then I was on T4 only, which I'm sure you know a lot about. Then I learned, I advocated for myself. I went back to college when I was 46, did my college diploma in nutrition. I'm like, I got to now help other people. So that's kind of a long story, but that's how it all began.
No, so, you know, it's not a long story, you know, and I wrote down some notes because you said so many good things and I want to take a moment to unpack them. It's funny, right? Because I do primary care and I do functional medicine. And in functional medicine, I spend an hour on the consult because that was like not even 2 minutes, right? Like what you brought to the forefront is that some people come say, ever since the thing. So you could have said that, you know, everything ever since my daughter's cancer. But no, it went way before that. It went like started way before, the stress before, and then the breast milk and like all, for years and years and years. By the time your listeners, my listeners, reach out and ask for help, the volcano has already erupted, right? So I'm glad that you actually gave some backstory, and I'm sure there's even more to it. And the other thing you mentioned is just how much, I just did a lecture moments ago for NPs, for other clinicians, how not to gaslight patients. Like sometimes it's inadvertent, sometimes it's without malice. Like as you, they don't know, you're fine, have a meal or whatever. Yeah. But then the last piece that you want to say, and then I want to ask you some more questions, is like, you had to go back to school. I had to go back to school. Like you have to hit a wall. You have to see the limitations, hit a wall, and then say, okay, there's not enough answers here, and go back to school. So everything that you said like resonated so much. So it's like, that is the journey. That is how you get to crazy. You have to hit a wall, and then you're like, I'm going to eat.
That's exactly it. And then the road back was really interesting for me because, having a child diagnosed with cancer is not an easy thing to overcome mentally. And then to be diagnosed with, and then there's another piece. My husband coded a year after, and it was all 3 years. And I'm like, but why? Why is this happening to me? And so for me, I've always believed there's always more to our journeys than just the science. So I explored the spiritual side of everything. I explored my upbringing. I explored the thyroid and what it means about speaking your truth. I grew up in a very strong Eastern European background, very loving parents, but strong. I was never allowed to say no to my parents. I'm sure you understand where that comes from. So I always analyze everything from all angles, including the science, and I try and bridge it together. So to optimize wellness.
So how did you transition from patients to advocate for other patients?
I started by reading Stop the Thyroid Madness, which is written by a patient who advocates for thyroid health. I think her name is Janie, Janie, Janie Boeing. That's how I learned. And oh my God, you would laugh so hard. I had one of the top endocrinologists at Mount Sinai Hospital in Toronto. He was known. He's since passed. And I came to him and I said, I need you to give me T3. And this is this would have been in 2012, maybe?
This is back in the how dare you stage.
Yes. And he looked at me like I had 4 eyes, like, what?
Who are you to tell me?
And then I said to him, I have issues with stress. I had a lot of stress prior to this, and I'm not converting. So you're giving me this T4, and it's just building up, but not converting to the active T3. As soon as I said that, he was wonderful because when he saw that I did my homework and I was educating myself and advocating for myself, which is what I want other people to do for themselves. You got to learn and be able to see. You're never going to be like, I don't claim to have the same education as a doctor in physical anatomy or anything like that, but I am my own best expert.
Yeah. Oh my God, you bring up so many points again. So just for the listeners, just a quick kind of thyroid refresher. Your thyroid produces T4, and whether it's underactive or if it's removed, like in Sandy's case, the conventional wisdom is, okay, well, since thyroid makes T4, we should just replace T4. That's your synthroid, that's your levothyroxine. It's not wrong. It's just not the whole story, because then once you have T4 is then converted to T3. And T3 is what actually does the magic in your body. So when you get T4, there's a hope that your body will then convert it to T3 and all will be good. But for some people like you, that wasn't the case. You're taking all this T4, but it's not converting, so the activity is not happening. So you're taking it and not feeling better. So, that's just like a quick overview for anyone who didn't know that. But the other piece that you said, which is so powerful, is that you know your body. I mean, this is why I call my podcast and my company The New Method, because a patient knows. And a lot of my clinician friends are so quick to tell patients, like, you talk about you didn't go to school. It's true. They didn't go to school, but they know that they don't feel well. Like, at what point does that count? Like, it has to count. And the frustration is real. And as if there's any clinicians listening here, just listen to your patient. Even if you feel they're misguided, you can maybe guide them in a different direction. But that hard no, like, I know better, is never going to get you. All it's going to get you is the patient's going to go somewhere. So I'm glad you had a good experience that this doctor was actually open to that. So then how did you then say, okay, I'm taking on a patient? Like, how did that happen? You started as a patient, but how did you suddenly take on other clients? Like,
I went back to college. This is after. I had to nurse myself back to health.
Sure.
I had to. And then mentally, physically. So for 5 years after having thyroid cancer, I'm not sure if they do this anymore, actually. They would suppress TSH. So TSH, thyroid stimulating hormone. It's actually the hormone in the pituitary. I know you know this, but for anybody listening,
please.
It's the hormone that is produced by the pituitary gland. It is actually not what your output is from your thyroid. And this is the crazy thing, because the typical testing, if testing is done, is thyroid stimulating hormone or TSH only. And it doesn't give the complete, sure, it's important because it's what's saying, okay, thyroid, start making, 80% T4, 20% T3, start doing the work. So it's important, but it's not the whole picture. And I had to have it suppressed. So I was virtually hyperthyroid for 5 years, which is the opposite end of the spectrum of where most people sit. Most people, and they estimate, believe it or not, that 60% of Americans are hypothyroid and don't even know it. So that's slow functioning. So I was high functioning for 5 years. And I somehow had to figure out my balance. Like, I went through anxiety, I went through all these things. And then I just kept educating myself on thyroid more because I wanted to be an expert in my own body. Then, of course, I went back to college, the Canadian School of Natural Nutrition, which is one of the largest accredited nutrition schools in Canada. And then, thyroid is kind of my jam. And now it's like thyroid and menopause, because I'm 54, going through menopause without a thyroid.
Oh,
and it's a whole new it's a whole new territory, right? Women have a hard time at menopause as it is, and a lot of these symptoms really cross over. So it gets so confusing. What is it? Is it my declining estrogen? Is it my declining progesterone? Is it my thyroid? Like, what's causing the anxiety? What's causing the hot flashes? Have I gone hyper again? So, it's so confusing.
Yeah. Oh
but that's how I kind of got into it.
Guys, that's awesome. So you brought up two kind of worlds, anyone who has thyroid issues and then menopause. And one of the biggest concepts that people talk about in both these worlds is a concept of metabolism, right? So what is metabolism?
So the easiest way to describe metabolism is you've got these chemical reactions in the body that change food into energy. And think of your thyroid as the thermostat. Is it happening fast or is it happening slow? And really, it's all about that Goldilocks theory. You want to be right in the middle. I already mentioned that one of the biggest issues is testing TSH only. But the other issue is that the range is so vast. We're talking a TSH of 0.5, and then some labs you look at, it's 5.0. If I'm 5.0, I am dead to the world. So, you really want to hit that sweet spot. And the majority of people feel best between a 1 and no more than a 2. I feel really good just around 0.5, 0.75, and I don't hit those hyperthyroid symptoms. And that's where it gets confusing. It's like, what is it called? Like a reverse measurement? Like low TSH actually means too high functioning thyroid. Too much. High TSH means too little. People get so confused by that, right? But it's so important to note that. So your thyroid manages all of it. It manages, are you hot? Are you cold? Are you sad? Are you happy? Are you hyper and agitated? Can you sleep? Can you not sleep? Like, I can name probably everything goes back to thyroid. And then the metabolism.
Yeah. I'm glad you mentioned the range. So for our listeners, when you go get your blood work drawn, and obviously there's a range of what's normal. And there's this wide range from 0 point something till sometimes 4 or 5.
Yeah.
And so what that means for you listening is that you can come in and your TSH will be 3.5 and your provider will tell you, you're good. You're good. Now, this average is an average of the sickest of the sick people, all these averages, right? So it includes people who have been hypo for a long time. And it's actually the average has been widening over the years. There was a time when it was clear to us that 3 was not okay, 4 was not okay, 5 was not okay. In fact, there are some algorithms that say don't even start medication until you're at 7. I cannot even imagine that. But yet, if someone's trying to get pregnant, suddenly the magic number is between 2 and 3. Do you notice that? So endocrinologists, I have a lot of women and they'll say, oh yeah, I've been to thyroid. And I'm like, I'm usually like between a 3 and a 4, but I'm trying to get pregnant. So my GYN said, we really have to make sure it's between 2 and a 3. I'm like, why do we only have to make sure it's between a 2 and a 3 when we're getting pregnant? And then after that, it's fine. So the range is really important. You're right. So many people really are hypo because they're it's coming up green in the labs, but it's not. But then the other point that you brought up that's so important is you're like, for me, I feel good at 0.75. There's personalization. There's customization. It's not a one-size-fits-all. Nothing is a one-size-fits-all. And someone else might be fine at 1.2. No one's fine at 3.5. You need to be able to dialogue with your provider and say, I get that 0.75 is a little lower than you used to. I don't feel optimal. And the trust. So, oh my God, so many good points. Empowering anyone who's kind of dealing with these labs, trust how you feel. So that's metabolism. But then, I know you mentioned that there's this connection to metabolic health or metabolic syndrome. Can you tell us what metabolic syndrome is and then how this is all connected?
So this is really interesting because when you have thyroid issues, you are more predisposed to having metabolic issues. Metabolic syndrome is actually a cluster of symptoms. So high waist to hip ratio is one. I'm always like, look at the body composition. Don't look at just what that number that honestly, I urge you, anybody who's listening, throw away your numbers only scale, please. Right?
Yes, preach.
Preach. Yes. Because yes, I believe that we need to keep on top, especially someone like myself. In 2022, I don't believe in labels, but I became, borderline, whatever you want to call it, pre-diabetic. We don't like to give labels though. But I was at a 6.1 HbA1c. So, and that was when I first started to experience menopause. It was like, so metabolic syndrome is knowing what your waist to hip ratio is, waist divided by hip. And for women, you don't want to be higher than 0.85. You might also experience high blood pressure. You might also experience just this bigger belly coming out of nowhere. You might also experience high triglycerides, issues with cholesterol, low HDL. These are a cluster of symptoms that indicate that you're at a higher risk for heart disease, stroke, and type 2 diabetes. So if you look at your master regulator, which is your thyroid, if it's not functioning right, many of those variables can turn to a not so great picture. And that is the connection. And obesity is the biggest one.
Yeah, absolutely. And, let's talk about that scale. I just, on my Tuesday calls with my GameChangers, I have someone who's really struggling with her weight. I'm like, what? Can you just throw it out the window? Can you just throw a scale out the window? So it's not just numbers. So BMI, when we go to the doctors, it's height and weight, and it does a ratio. And it's such an injustice because I want you to imagine, for anyone, let's just close your eyes for a second. I'm going to paint 2 pictures of somebody who weighs the same and maybe is the same height. So you have the person who is whatever, let's just, a certain height. They are carrying all their weight. Their waist and their hips are more or less the same size, or maybe the waist is a little bit smaller than their hips. They are big and they are muscular and they weigh 200 pounds.
Mm-hmm.
Same height of a person, but now this person carries most of that 200 around their belly. That's what we mean by waist to hip ratio. So their waist is significantly larger than their hip. Both the same height, both coming at the same weight. One is a triathlete and the other one is on the way to a heart attack. So the BMI is just not it. So even if you don't remember the formula that Sandy just gave you, visually, if you're carrying your fat around your middle, the problem with that is that it's surrounding your organs. It's what we call visceral fat, and that becomes dangerous. And that's part of the metabolic syndrome that Sandy was talking about. So that's what we mean. So who cares about your scale? Throw it out. Where are you carrying it? Where are you carrying it is more important. I'm so glad you brought that up. And
I agree with you on that whole BMI thing. It's crazy because I've been lifting weights for 6 years, and I'm not going to tell you my weight, but I know that if I were to tell you my weight, you'd probably be like, holy crap. Like, not you wouldn't, but somebody else might.
Right.
And they'd be shocked. But I know what my bones are. I know I have a really healthy bone mass for a 54-year-old woman. And I know that I have very healthy muscle. And these are the things that I really look at. And then you look at visceral fat, right? So those are the metrics that actually matter to me, but not from a regular scale, only from my body composition scale. And there's new ones out, by the way. You know that there's a new one out that's...
Tell us.
Oh my God. It's made by, I don't know. I just know that it's like 97% as effective as a DEXA scan.
Wow.
Yeah. It's new. I think it's called the Body Pod. I have zero affiliation with them at all. It's just that I'm fascinated by getting as close to accurate, because I have to get, you guys call it a DEXA scan. In Canada, we only do the bone mineral density. So you can't get the whole composition. I mean, unless you pay for it, I guess.
That's crazy.
Yeah. So I like to know where I'm at for bone, because bone comes into play with thyroid as well. So, and I was suppressed for so many years that...
Oh, yeah, absolutely.
Yeah.
So anyone listening, if you're in our age group, by the way, I can't believe you're 54. You look gorgeous.
Oh, thank you.
You're welcome.
You're the same age as me?
I'm 52.
Oh, okay. Close.
Yeah. So if you're in our age group, it's time to start thinking about osteopenia, osteoporosis, fancy word for are your bones strong? This is the reason why when we're older, if we trip and fall, we could break a bone, and then that's like, harder to recover. So very important. There's so much we could do about it. And anyone suffering with thyroid, as Sandy is certainly more at risk for that. So I'm glad that you're on that. So there's that. I mean, I guess then we covered like how thyroid health affects our health span, because you talked about like cardiovascular risk. Is there anything else that we're missing on that?
Well, here's the thing. It's not, you hear all these experts talking about NAD and all these really sexy topics for longevity, but nobody really talks about thyroid as it relates to health span. We all know that obesity actually will give you a higher chance of many diseases. Thyroid is closely tied to obesity. And then there's health span. Like, how healthy are you going to age? So all of it is really intertwined in this little knot, but thyroid is 100% in there, because if your thyroid is not really well managed, you're not going to age well. You're not going to live a healthy, long life.
So you're saying, and I hear what you're saying, like we're focusing sometimes on, and NAD is important, it helps our mitochondria, certainly. Yes. But you're saying we're kind of like looking down here at this little kind of speck on the wall. But hello, hi, are we making sure that up here we're on point? And that's so important, like upstream. Before we worry about the downstream, let's worry about the upstream. Like, what are we doing up here?
Totally, because here's the thing. If your thyroid is not optimized, you're not going to have the energy to go and exercise, which we all know will improve your health span and lifespan. Let's start with making sure we're optimized, whatever your optimal is, and then my optimal. And then the other factor is that, like 90% of thyroid hypothyroidism, clinical hypothyroidism, is related to an autoimmune disease, which again is going to affect your health span and lifespan. So it's like there's so many different layers to this, but not really spoken to all together.
Yeah. And if you go into like, we're talking upstream, or like if anyone's listening to me visually, like just think of it like, the top of your pyramid. You have to make sure the top of your pyramid, would be in camera. You have to make sure the top of your pyramid is on point, your thyroid. And then everything else kind of comes from there. So if that's not on point, nothing else is going to be on point. Right. So I'm still going to mention that. So with that in mind, knowing how important it is, how do we make our thyroid function better?
Ooh, okay. There's many factors. Again, multi-layered, but it all starts actually with nutrients. It's all going to start with nutrients. So there are very important nutrients for optimizing thyroid health. One is selenium, iodine, but not too much iodine. Again, back to that whole Goldilocks, right? Selenium, iodine, B vitamins, vitamin D, zinc. These are all critically important nutrients, and a lot of us are really deficient in a lot of these important nutrients. Also B vitamins. And even like people don't realize that, you know, you hear that all the time. Oh, I don't need supplements. Like, well, I know. See, you're laughing. But
like, wait, what's that too? Come up to you, sis.
I don't need supplements. But I'm like, wait a minute. Do you have a garden? Are you growing all your own food? Do you rear your animals in pastures behind your home? Can you ensure that there's no drift? Because that's the other thing that can affect your thyroid is toxins.
Sure.
Huge, 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 huge. And then there's chlorine and fluoride, and all of those are considered halogens. And that's one thing I talk about in my thyroid guide. And it was so funny. I brought it to my pharmacist and he's like, halogens. I'm like, do you remember chemistry?
Yeah, right. Noble gases and halogens.
Yeah, but like those look similar to chemically to iodine, which is the actual nutrient that your thyroid needs. But if you're not getting enough of it, and yet your water's really chlorinated heavily, and you're using fluoride toothpaste, those are going to take up a parking spot in your thyroid and wreak havoc. So that's another thing to consider. And you know what? You're going to find this crazy. I was reading, I'm not going to name where I read it, but it's supposedly a very important resource for thyroid. They actually stated, that causes of thyroid disease are unknown.
I am not unknown. That's so big.
Is that crazy?
Causes of all autoimmunity is unknown according to all the resources. It's just magical.
It's just magic. It just shows up. So those are some of the things.
Luck of the draw.
Yeah. Yeah. It's only genetics, right? Only.
Yeah, no, it's only genetics. You can, you have when you live inside a factory of chemicals, you'll be fine.
Yeah. Yeah. So nutrients are important. Toxins are important. Being able to manage stress. I mean, we all have stressful lives. You cannot take your stress away, but you can kind of almost bubble wrap yourself. I talked about that once before. So taking certain nutrients to ensure that the stress isn't doing damage to your body and your nervous system. I know I'm one of these people that I have to really be cognizant of this. So, and then sleep and then movement. Like all of these things come into play for a healthy thyroid.
Yeah. So the answer to the question, how do we make our thyroid healthier? What do we do? Is all the things that we know to make anything healthier, right? Like the sleep, nutrition, the movement, and supplements. I have to say, I mean, the supplements in general are so important. But when it comes to the thyroid game, you cannot be playing the thyroid game if you're not taking supplements. If zinc and selenium are not important, and you're right, too much iodine, people don't realize, can flip you to the other side. But there's just no, I don't know why some people think supplements are just like, you just pee it out when you don't need it. Like, what's the point of taking it? Every chemical reaction that happens in your body requires vitamins and minerals. You cannot function without them. And there's no shot you're getting enough nutrition. Unless you are like, that is your entire full-time job is to figure out your macro and your micro your entire day. There's no shot you're getting it. Anyone who's in the health game, any one of us that's doing this, if I show you my supplement closet, there's a lot of supplements because there's no way. And I'm very focused on my food. I'm sure you are too. There's no way you're getting without supplements. The other thing that I do tell I didn't hear you mention it, but I tell my patients, you don't have a thyroid, but my patients who have a thyroid, I have them go gluten-free because of the damage that gluten does to the thyroid. Do you agree with that?
So I actually worked with a client once who had Graves, which is the opposite of hypo. It's hyper. And yes, there are a couple of almost non-negotiables. Mm-hmm. One is gluten. And that's mostly because of the autoimmune component, right?
Correct.
Like, and then dairy. You know, often it's dairy, but you know, gluten's a big one for sure.
Yeah, gluten's a big one. Those are my two non-negotiables too, gluten and dairy. Some other stuff we're gonna have to figure it out. I'm gonna have to convince you. But with autoimmunity, those two things, there's just no room for it in this country, at least Canada, U.S. Yeah. I know gluten's a little different in Europe. So the thyroid is your jam, clearly. Bring us to your book because it's out, it's coming out. What's happened? Where do we get it?
This is it. I have it here. It's the Essential Thyroid Guide. And what I did was I purposely made it and it's so funny because one of the reviews said, I love the large font.
This is
right?
And show me the print.
Okay. So I made this. You can, by the way, this is my own version. You can find something similar to this.
Oh, I love that.
I never created this, but I did. This is my version, doing color coding and everything, because I wanted a chart to make it easy. So that's what this is. And you could see every page has notes. And the reason I did that is I want every single thyroid patient to be able to write anything that's applicable to them.
Wow.
Bring it with them to their doctor and have a discussion. Because what I'm providing is certainly not medical advice. It's patient advocacy and learning how to really advocate for yourself. Because I have many friends and family who they're like, Sandy, give me the Coles notes. Stop, right? And I'm sure you get that too. And so this book is the Coles notes. This book, and then one of the reviews, they actually said I would have had to go to 4 different books, including clinical books, to get the information that's just highlighted here. It's for those people who do not want to read a 200-page clinical book. That's what this is for.
I love that. That's me all the way.
Right.
I read them anyway.
As a doctor.
I don't want to. I love that. Did I miss anything? Is there something you want to tell our audience, our shared audience, that maybe I haven't covered?
The Essential Thyroid Guide is out now. It's on Amazon worldwide. But I am writing another book. So my degree is actually English literature. I'm an English literature.
Oh, yeah, that's my first degree too.
You're kidding. So then you love to write.
I love to write.
Yes.
I write all my own content, yeah.
Yeah. I love to journal. I love to write. And so I'm about 30,000 words into my actual book, which is, the working title is Bridging the Gap Between Science and Soul. The reason I wrote this is, you're going to laugh at this, maybe, maybe not. I lectured back in 2022, and I talked about my journey to wellness. How did I get here? And a lot of it is very spiritual. And there was a doctor who was sitting beside me. I really got along with her wonderfully. And she turned and she looked at me. She goes, Sandy, I don't know if I believe in all this BS about crystals and woo and all that stuff, but I like you and I support you. And I said, okay, well, thank you. I appreciate that. But if it weren't for all of the esoteric, I wouldn't be who I am today.
Mm-hmm.
And all of my practices that I've learned. So this book is bridging all of it. So there is science, because I feel science is very important, but then there's stuff that we just can't control and we just can't really explain. But how do we stay healthy and well throughout all of it?
That's so important. And anyone listening should definitely get this book. And I would say that the soul is everywhere. Like in addition to doing this, I also mentor younger business women, and I can give them a checklist, but I also have to have this conversation about their soul and where are they and what are they thinking and what's in their way. What is this voice versus this voice? You know, I think it's really important to infuse the soul in everything, in science, in business, in every part of it. It has to permeate. That's what makes you so good at what you do, because if it was just the algorithm, you know, you could just look that up. There's so much more than that. We are way too multidimensional for it to be just the algorithm.
Yes, exactly.
Yes. Oh my God, I love it. What a great title.
Thank you. Well, hopefully I'll have it done before the summer, although my kids just moved back. So it's like distraction everywhere. Like, I need you to go to work. Go to work.
Go away. Everybody go away. That's so funny. All right. Thank you so much for being on this. This is amazing. And maybe when your book comes out, you'll come again and can let us know about it. We would love to have you again.
Thank you. Thank you so much.
Oh my God, of course. Tell everyone in the world how they could find you. And of course, we'll put it in our show notes.
Okay. I am everywhere. It's just Sandy K Nutrition everywhere. I'm on Facebook, Instagram, TikTok. I'm on Rumble. You'll find full uncut videos on Rumble. I am on YouTube. I have a Substack. Haven't written too much in there yet. So I'm kind of everywhere.
Oh, I love that. Amazing. So find her, Sandy K, the letter K, Nutrition, everywhere. Sandy, thank you for being with us.
Thank you.